Waiting for everyone to join. Good morning, everyone.
Alexa, play Beach in Hawaii, Ziggy Marley.
Good morning, everyone. Hello, hello. We are live in San Antonio, Texas, doing a super mommy today with Dr. Cornejo, Dr. Latin Heat. There we go. Okay, we're getting some people on here. Good morning. Feel free to ask any questions you guys have. We can help. There we go. We are showing this one on YouTube. If you guys want to check it out, on the link in our bio, you can check out our YouTube where we have it live. You can see everything going on, the uncensored version. Uncensored, uncut. Good morning, good morning. Thank you for the heart. Got some people on here. Good morning, Rose. Good morning, Angelica. Good morning. Good morning, Instagram people too. Here we go. So we're live right now on TikTok, Instagram, Facebook, and YouTube. There we go. We got a YouTube person on. Good morning, honey. How are you this morning? Good. Glad to hear it. Hola, buenos días. Go here. We're doing a super mommy makeover. So we're doing lipo 360. She's getting a breast aug. Is she getting a lift?
No,
just a breast aug. 450 on both sides. And then she's doing a tummy tuck. BBL. I don't know if I said the BBL. How long is the healing process from a BBL?
About a month, you just have to be very careful not to put too much pressure for the first month. After your surgery, that's the key with the BBL, just pressure uploading.
There you go, Arlene. So about a month, just being careful to not put a lot of pressure.
Patients get the BBL mattress, BBL pillow.
Making sure you're using all the proper aftercare. Hi, guys. Yeah, of course. Arlene, if you're interested in learning more, I just went ahead and pinned that form on the bottom or in the bottom left corner. You can learn more about pricing, more details about the post-op information, financing options we offer, specials, etc. And guys, we are showing this on YouTube for anyone who just joined us. You find the link in our bio where you can go to our YouTube and you can see the uncut, uncensored version. You can see it all. TikTok limits us, Instagram limits us on what you can see, so YouTube shows it all.
300 from the left one.
I'm gonna try to switch over here. I'm gonna turn you guys to me. And move this way. Very carefully. Good morning, guys. Good morning, Mama Bear. We are here in San Antonio, Texas, doing a super mommy makeover with Dr. Cornejo, Dr. Latin Heat. Good morning. Good morning, Windsor. Thank you for the rose. How are you this morning, Doc? Hanging in there? Doing good?
How are you?
I'm good. Thank you. Thank you for all the roses. I appreciate that. Good morning. Good morning, guys. Thank you for joining. Just feel free to ask any questions or anything you want to know with plastic surgery, any questions for the doctor. We are happy to help. And if you guys have questions on pricing and specials we have going on, you can fill out that form I just pinned on there, and our team members can help you with anything that has to do with financing, pricing, etc. Good morning, Linda. Right now we are doing the lipo portion on the back. We'll flip, do lipo portion on the front, tummy tuck, breast augmentation. Guys, again, for our new people, we have this live on YouTube as well. We are located in San Antonio, Texas, in the Stone Oak area. After a BBL and with lipo, how long until you get your first massage?
BBL, lipo. would recommend to wait maybe a couple of weeks. Just because you're gonna be a little sore after your surgery. I know some people want to do it early, but
After your
it
first.
may be very painful if you do it like right after your surgery. So I tell my patients that they don't have to need to have the massages, but if they want to do them, just wait a couple of weeks.
Wait a couple of weeks before. Did you get all that? Flip. Move. It's tight today, that tight little squeeze right there. Good morning, Lisa. Good morning, guys. Happy Wednesday. Thank you guys for joining. Right now there's just one. How many do we have operating today? 4? 3? I think Barlow, Cornejo, and Jeneby, I think. I think Barlow has one at like 9:30 or something. So we have 3 today. So the same person who asked the massage question, she's asking, so you don't recommend right after the drain of the liquids?
No, I don't recommend it because it's gonna be painful.
Saying it could be painful to do it right after.
More uncomfortable with anything other than anything else. And normally your body gets rid of that excess fluid. You can use the roller if you want. It's cheaper, and you can do it at your own pace, at the comfort of your home. So yeah, just to simplify things.
Good question. Guys, we are showing this on YouTube as well if you want to see the full surgery going on versus my face or Dr. Cornejo's face. Good morning. You can check it out on the link in our bio. There's a link to our YouTube where you can see it live right now. Go. Good morning, guys. Feel free to ask any questions you have. We can help answer as many as possible, if allowed. Pricing questions, you're going to have to go through the form down below that I just pinned. And any medical advice, unfortunately, can't be given, but we can answer some general questions. But so we have this one, the Super Mommy Makeover, and then we have another Super Mommy after this. Is it?
I think it's a corridor.
Oh, okay.
It's like a breast surgery.
Yeah. Reconstructive, replacing the breast implant, etc. So that's what we have later today. In a couple hours. Right now we're doing some lipo on the back. And again, if you want to see this all for yourself, you can hop on our YouTube page right now and see the live, the entire live surgery. Thanks for joining us, C. Everyone's sleeping today or what? It's just the three of us.
What's that?
Said it's just the three of us this morning. I'm used to it being like trying to maneuver around everyone.
Yeah.
Good morning, guys. Good morning. Thank you for joining. Happy Wednesday. Good morning, Timothy. Hi, Dorothy. Awesome. We're in San Antonio, Texas. We are doing a super mommy makeover this morning. So lipo 360, BBL, breast augmentation. She's doing 450 on both sides. Tummy tuck. And we're also adding, she's doing the lipo 360 with Renuvion. Good morning, guys. Got some new people joining. Cool. Good morning, Mel. Good morning, William.
Linda, 500 on each flight.
Last week today. So Timothy, you did a super mommy last week with Dr. Phillips. Thank you for the follow, Kimberly. Awesome. How are you feeling? That's great. Glad to hear it. One week in recovery, so that's good. Thank you guys for joining. We're live right now in San Antonio, Texas, with Dr. Cornejo, doing a super mommy makeover. And I see we have some people on YouTube now too. Just for Instagram and TikTok, just to let you guys know, if you go to the link in our bio, you can check out our YouTube page where we're showing the entire surgery live, um, where it's uncensored. Thank you guys for joining. Good morning. Good morning, Lily. Right, yeah. That's why I tell people about YouTube, because I feel like it's more exciting to see the whole surgery. So I understand why you'd move over there. Okay, we have a couple questions. So before a procedure, does the person need a doctor's checkup?
Sometimes, yes. If
Some.
there's any health problems that we identify, we usually would get some sort of clearance to make sure that it's safe for you to have anesthesia. Typically, some people are just healthy and they don't need any type of clearance. So we always do a blood work and everybody.
Could you hear that, Linda? And then Tina's asking, do you do calves and ankles for lipo and skin removal?
Calves and ankles?
Lipo and the calves and ankles. It says lipo and skin removal.
I've done that, yeah.
He's done it before, Tina. Here you go. I have to put the form on here, and you can get more info on that for pricing and details. Okay, great, Linda. I'm glad you could hear it. 8 hours of surgery. What did you have done? Thank you for the follow, Tina. Arm super mommy makeover, everything. Awesome. How do you feel?
Yes.
Yes. I don't know, which doctor did your surgery? She said it's on this YouTube channel. Thank you for joining, Patty. How soon can you get scheduled in? I mean, we can get it as soon or as late out as you really want it. When do you do consultations? Tuesdays?
Yeah.
So he does consultations on Tuesdays. The link, if you fill out that form, then you can have someone will call you here shortly and schedule something for you, or you can go and click the link in our bio and fill it out that way as well. Or in the bottom left corner, that's an option too. She said, Dr. Phillips, I just moved over. Oh, nice. Oh, okay, yeah, we were just talking about it. Awesome. So you moved from Instagram over to YouTube. Got it. It's more exciting to watch it on YouTube for sure. What areas are included in a lipo 360? It's the front and the back, but I'll let Dr. Cornejo talk about it a little bit.
Yeah, we do like your abdomen and your back. In your back, we do like the brow rolls, the axillary rolls, the upper back, and the lower back, like the flanks.
And if you want to add on more, like arms and
sacral area as well sometimes. And then in the front, we do your upper and lower abdomen, your flanks, and the lateral area of your torso. So it's like circumferential liposuction, really.
And yes, you can do add-ons for arms and everything else too.
Absolutely.
Thank you for the follow. Of course, no problem. Back in 2008, I had a pulmonary embolism due to a birth control patch. Will I still qualify for surgery?
I would be very worried. I really cannot tell you that you would, because that makes you extremely high risk. So, really, very thorough evaluation is needed. But it's, it's not very risky sometimes. That makes you extremely high risk for another block on your lungs, and that worries me. It worries me a lot.
Good morning, guys. We have some more people on YouTube now. Just a reminder, guys, we have YouTube live going right now as well, so you can check that out through the link in our bio. Head over there and see the whole surgery going on. Hi, Lolita. Good evening. It's good morning over here. Where are you at? Where are you located? Thank you for the heart. The heart to me. Got 3 new followers on here. Guys, feel free to drop in your questions or concerns or anything you've always wanted to ask a plastic surgeon and haven't been able to. And anything to do with pricing, specials we have going on, financing options, just fill out that form I just pinned on here, and one of our team members can help you. Hello, Angel. How are you? Got Linda to move over to YouTube. It's much different over here, right? Hi there. I'm new here. I'm thinking of getting a tummy tuck. Worried about the aftercare.
Don't worry about it. We'll explain everything to you. Not that bad. Just 6 weeks of precaution. You gotta be able to for 6 weeks. So that you have to see your time off you're gonna take from work. You're gonna take at home. But all you need to do is relax and don't do any heavy lifting or strenuous exercise. Move around. Walk a lot. But it's not as bad as people think.
There you have it. Hi, Cricket. We are in San Antonio, Texas. Wanting to get a full body lift. How long is the recovery?
What?
A full body lift?
Full body lift? Yeah, 6 weeks. Any major surgery, guys, it's 6 weeks of recovery. Any major surgery. The first 6 weeks are the most important.
No, Rosa's not in here right now. But I'm glad to hear you are. I will let her know for sure. No problem, Cricket. Thank you guys for joining. We are live in San Antonio, Texas right now with Dr. Cornejo doing a super mommy makeover, which is going to be a tummy tuck, leg bow 360, BBL, and a breast augmentation. She's doing 450s on both sides. We're listening to some reggae this morning. For now.
Change rapidly.
Is there a certain percentage of fat he can only transfer to BBL? So you should be at a 38 BMI or lower. 38 is kind of the highest. But is there a certain percentage of fat that you can only transfer to the BBL?
Yeah, there's a limit. Everybody's a little different, but there's some limit. You put the fat into a compartment, and so that compartment has a limit. Everybody's a little different, but sometimes you have to go back and do a little more.
How long after BBL can I start carrying my 1-year-old? So any heavy lifting?
Maybe a couple of weeks. If you just a BBL, you're gonna be a little sore, so just precautions for like a couple of weeks.
Did you hear that, Esme? And so we're getting a lot of questions now. Thank you for the follow, guys. How long? Okay, so how long will surgery be for a mommy makeover? About 4 to 6 weeks.
The recovery?
Yes.
6 weeks. Yes.
6 weeks there.
Precautions.
Is there a risk getting a BBL having rheumatoid arthritis?
As long as it's well controlled, you can probably do it. But if you're so severe that you cannot move around and walk, then not a good idea because you need to move after surgery. So it depends on the medications that you're taking as well. Because some of those medications can be really strong and prevent wound healing. So very important to get a very good evaluation.
Zio, did you hear that? Linda, a BBL is a Brazilian butt lift. It's when you transfer fat from other areas to the butt to give you a rounder, bigger booty and a slimmer waist. Give you an hourglass kind of look. Which doctor are you seeing tomorrow? Linda, we all want that, huh? That small waist and big booty. My BMI is 33. I really want to do it in the States. That's why I'm asking the question. It's a little different in Mexico, even the aftercare they want. That's not the same week. Yeah, we actually have a couple videos on this on our TikTok and our Instagram about doing the procedures outside the United States. A BMI of 33 is decent. That's a one we can definitely do. We're just a lot more cautious with the aftercare here for sure. She's saying that in Mexico they want to do the massages the same week.
Yeah, I mean, everybody has different ways to skin a cat. It's not bad, but I'm just gonna be a little uncomfortable. That's it. We can tilt him afterwards, Mila, please.
Lorena, what state are you located in? go. Lux, you are saying you need prove on a tummy tuck. What do you mean by that? Oh, okay. So you're close enough then to come see us over here. Dr. Cornejo does great work, so that'd be a good option for sure. We do have specials and a ton of financing options, Lorena. Good morning, guys. Thank you for the follow, Tanny. You guys, if you have any questions or concerns about surgery or things you've always wanted to know, please feel free to ask in the comments. If you're interested in any pricing questions or learning about financing or scheduling a consult, you can fill out that form I pinned on here. And one of our team members, we have team members standing by right now to answer any of your questions about that as soon as you fill out that form. Yes, we do. So we can definitely, if you want to fill out in our link tree, the form to talk to one of our team members, we can send that over to you so you can see more of his work. Yeah, she's saying, oh, yeah, well, there's on the Instagram. She was saying TikTok, but on Instagram, you can look at all the before and afters, too.
Yeah. Before and afters, specifically on Insta. TikTok, we can't. I'm going to pause these really quick.
Or Dr. J's texting us right now too. I'm like,
Where do you have that?
well, I guess because Joe John's out of town this week, and so he's asking if someone's going to be in there with them, but we didn't. Joe John didn't have us covered. Like, he didn't ask us to do anything this week, so we thought he had it covered. That's why I was trying to text Deanna, and I'm like, are you going to come in? And
Oh, gotcha.
but he didn't ask us. We thought he had it covered.
Gotcha. If you guys have to split, don't worry, okay?
Okay,
I know
might.
sometimes version is like back and forth, but whatever you guys need to do.
Well, I'm trying to see what he had. Oh, she just responded. Let's see.
She's doing very well here. Let's level her though, please.
Awesome. Thanks, Lorena. Sounds good. Good morning. Good morning.
Almost there. And then we took 300 from the upper level.
Good morning, Nancy. Guys, just a reminder that we are showing this one on YouTube. So if you want to see the full version, not just my face or Dr. Cornejo's face, if you want to go to YouTube, you can see the whole surgery being done. Like I said earlier, uncut, unfiltered. The real deal. Good morning, guys. Thank you guys for joining. Happy Wednesday. Hope everyone's having a good morning so far. No, it's early. Well, for us, it's kind of early still. I just went ahead and pinned something on the screen for the next 20 seconds. If you guys have questions about our specials or pricing, financing options, we have a ton of financing options, some that go to almost up to 10 years, to pay over 10 years. So if you're looking to get your dream body done, it's a good option for you. How long does a tummy tuck, lipo, and BBL take? So depends really on how much is being lipoed and all that, but probably what, 2.5 hours? 3 hours?
360 lipo?
Yeah.
Yeah, it's good for that.
Some between 2.5 and 3 hours. When on this TK on this patient, we're doing a lipo 360 super mommy makeover, which is gonna be a lipo 360 BBL. She's getting a breast augmentation and tummy tuck. So she's doing everything you're saying, plus she's getting a breast augmentation done. Does she have any now or no? She's getting new ones or
She's getting, no, she's getting implants for the first time.
honestly, all of the surgeons here are really great. She's asking if I recommend Twilight or General. Do you have that? Is that what you're having done? The tummy tuck, lipo, and BBL?
Well, Twilight anesthesia, she means not Dr. Twilight.
Oh. Well, it was the way it was spelled. That's why.
Yeah.
I was like, oh, okay.
You have a Dr. Twilight.
What did you? I asked you the last time because she spelled it like Dr. Twilight.
Yeah.
What did I asked you last time about what you thought about Twilight? Wasn't it? What didn't I ask you that question last time over there? thought so.
Yeah, I believe so.
Highlighted was like total ID, like
It runs a gamut of experiences. One, it can be very light, supplemented with local anesthesia, or we can do a kind of a total intravenous anesthetic where they're essentially asleep but they're breathing on their own, and it's just a heavier version of what we just mentioned. A lot heavier, actually.
TK, can you hear that? That's coming from our anesthesiologist.
great answer.
Yeah, that was a great answer.
We have the best anesthesiologist in town, with a little experience, so
We do.
you can do any type of anesthesia, whatever is safe for you.
Awesome. Here you go. I'll send you this so you can ask any more questions you have too.
Should deliver to the safe room, actually 2.5 hours.
Thank you for the follow, Maxine. And TK, if you're interested in watching, we do have this on YouTube too. If you go to the link in our bio and you go to our YouTube page, we're showing the whole thing on YouTube right now where you can see the surgery actually being performed. Thank you for the follow, TK. Thank you guys for joining. Good morning. Good morning, everyone. Thank you guys for joining. This is the Renubion, right?
Yeah, there. Plasma.
Guys, feel free to ask any questions you have. If you have questions for our anesthesiologist, for our search for Dr. Cornejo, for our surgeon, if you have questions, general questions, I can answer some. Or if you have questions about pricing, you can fill out that form right there that I just pinned on here.
1.5 to the plan.
Good morning, guys. Good morning, Instagram people hopping on. Good morning, Lisa. Good morning, Elite Travel Agent. Have you had patients in their 60s? Yes, we have. We actually have quite a few patients in their 60s come in. I think we have a couple later today too. So yes, often we do. I believe the next one you have is in their 60s, aren't they? Maybe, maybe not.
I'm not sure.
Yeah.
Yeah. As long as you're healthy, it's okay.
As long as you're healthy, it's okay, Linda. It's coming from the doctor. Good morning, Vicky.
One. That.
Good morning, Elda. Also, we have 6 new followers on TikTok. We have 5 people watching on YouTube. If you guys want to, anyone who's just joining us, we have this on YouTube where you can see the entire surgery going on versus just my face or the doctor's face. If you click the link in our bio, you can head over to YouTube and check that out. The anesthesia isn't put on your back, as I know when I have my baby, they messed up back. So that's, you're talking about an epidural, I believe, right, Doc?
We don't do epidurals for
She's making.
cosmetic procedures.
She said the anesthesia isn't put on your back. Is it when I had my baby 2 years ago? They messed up my back up, and I had to get 3 blood patches. To this day, my lower back hurts.
Yeah, that sounds like an epidural. And we don't utilize neuroaxial anesthesia here, so that's kind of off the table.
Okay. So the easy answer is we don't use that. The more complicated answer is schedule a consult. Right? That's not a good feeling though, Lorena. Sorry that happened to you. I'm thankful I had 2 epidurals and neither one of them I had damages from.
To the brown.
We do have some specials going on. I know, I don't know if we have any on our June specials. Let me just double check. I think that's mostly for the Father's Day specials. I'll tell you right now.
One to the upper back.
So on our June specials, we do have a special on lipo, but our team members that help with answering any questions about pricing and financing, they would be able to give you the specials and promotions we have currently today. Excuse me. So if you click the link in our bio and you fill out that form on Instagram, one of our team members will contact you and let you know those specials and promotions. Sometimes we have some that come up daily. It just depends on what exactly you're looking for, when you're looking to have it, etc. Good morning, guys. Yes, that's correct. He does his consultations on Tuesdays, and you said you're 3 hours away. He also can do a virtual consult if needed.
Absolutely, yes. We do for virtual consultations.
She's in Texas, but she's 3 hours away.
Yeah, we can do a virtual. Send us a DM. What procedure you're interested, and we'll reach out.
Good morning, guys. Good morning. Happy Wednesday. We are live in San Antonio, Texas, in the Stone Oak area this morning with Dr. Cornejo, Dr. Latin Heat. We are doing a super mommy makeover this morning, which is going to be lipo 360 with the BBL, a breast augmentation, and tummy tuck. She's working on her Renuvion right now on the back side, and we'll end up flipping.
And then we're going to do the lipo transfer.
We'll do the BBL and we'll flip the lipo on the front and the breast augmentation. So Vicky is asking, she said, what he's doing right now, this is on YouTube, what he's doing right now looks like it would be pretty sore later. I've heard him say he uses a lot of medication for pain that lasts for 3 days.
Well, not for the lipo, guys. For the lipo, we put a number medication and then infiltration fluid. But that one just lasts for a few hours. So yeah, you'll be a little sore from the liposuction and the renuvion, especially on the back. Sometimes patients complain of tenderness. But but people will take some pain medication for the next few days and they're okay. But it is an invasive procedure, so it's expected to have a little pain or discomfort. But that's what it is, a little pain or discomfort.
Did you hear all that, Vicky?
No pain, no gain.
No pain, no gain. Lorena on Instagram, I know you had a special a couple weeks ago. I contacted Lily and she was contacting me on Friday and never received a call. It's a special for Super Mommy Makeover. Send us a DM and with your info, your name, your email, and your phone number, and I'll pass that on. If that was told to you then and there was never a call back, then I'm sure that will be extended to you. I'm sure they'll keep that special extended to you. But go ahead and send me your info and I'll pass it along here in the office. Good morning, guys. I'm going to go ahead and pin that form here again on TikTok if you guys are interested in learning about our specials, scheduling a consult. He does consultations on Tuesdays, virtual and in person.
We can level her the left to right. And we can call for the nurse. We're going to do the BBL now, guys.
We are, if you guys want to head over to YouTube, we're transferring the fat now from the, everything that we just got from the lipo, the fat we got from the lipo, we're going to put it into her booty. Give her a round, nice butt. The link to go to YouTube and check it out is in our bio on both Instagram and TikTok if you want to check that out over, or go to that right now, and then you can check out the YouTube going on. But it is showing everything, so just be ready for that. I'm sure the doctor remembers me commenting it was also on a live. If my BMI is high, your BMI should be under 38. Is that right?
Yeah,
38?
I mean, you know, I tell people that if their BMI is greater than 35, they need to be as close as 35 as possible.
Okay.
If it's less than 35, they need to be at 30, as close as 30 as possible.
Okay.
The further you get away from that, the more issues you may have, and the outcomes may not be the same. You know, there's a lot of things that can happen. That's why we're so careful about BMIs. You know, and now we can offer medical weight loss, so there's really no excuse to be on a better weight. We can help you with a lot of. Some people get on Manjaro or
Right.
other medications, and they lose the excess weight, and then they get their surgery and they're very happy.
So if you're over, the doctor's saying that if you're close to 35 as possible for your BMI, but we do offer things like Manjaro that can help you lose weight to get there to that point, and then you could be a better candidate for surgery to have better results. Oh, she's at 33.
Oh, you're fine.
You're good then.
33 is fine.
And then on here, Vicky, I'm seriously contemplating having the surgery after I lose the rest of the weight I want to lose. That's awesome. She's lost 96 pounds. Good for you. She's 61 and at 33 BMI. So you would be a good, as long as you're healthy otherwise, a good candidate for surgery as well.
33 is fine.
And again, just like Dr. Corneo was saying, there is a Manjaro shot that helps you lose weight as well. So you can get to that point a little more easily. Yeah, it's super interesting, right? It's exciting to see this stuff being done. So now we're just getting ready to do, I can turn this on YouTube.
Okay, so now we do tomato bisque. And the fat, breakfast fat, high quality fat.
High quality fat.
Quality.
High quality H2O.
So we have about 1,500, which is going to be good volume. Very good volume.
That's a good point, Vicky. All that is from what he just did. Yes, so that was all from the lipo he just did right now on the back. The high quality fat, yes, correct. That was all done right now. I have loose skin. Do I need to be at a certain weight before surgery and depending on my height? I have loose skin. Do I need to be at a certain weight before surgery? So you said you were at 33 BMI. Depending on my height, I'm 5'3". And remind me, you said you were looking to do the mommy makeover. So with the tummy tuck too. I think it's just, right? It's just the BMI versus the height versus weight.
Yeah, so there's a little formula. I think there's a link in our page.
The BMI calculator?
Go to Dr. Google and just BMI calculator and then just put your weight and your height and it will calculate.
I think
I'm going to start with the hip and I'm going to put 100, you said? Mm-hmm. And then we have 100.
Yeah, Vicky, she is having a breast augmentation as well. She's getting some implants, 450 on each side. Okay, perfect. So that's how you then you're good to go on that then, right now on Instagram. Thank you guys for joining. Oh, so maybe a lift then, Vicky. Thank you guys for the follow. My hips are popping this morning.
I'm going to ask you a quick question. The TPS drill that you guys have, that you were using for like shaving down some bone, have you used it? No? Okay.
We haven't.
Yeah, I just wanted to see if it worked or not. Possibly
I know
use it.
John has checked on it and it works, but we haven't used it. We haven't had it for years.
Right flag 100.
Right now, guys, we are taking all the fat he took from the back side and putting it in her butt area to give her that round shape she's looking for, the volume, the roundness. Thank you guys for joining. If you have any questions or comments, please drop them in our comment section on our TikTok, Instagram. If you have any questions about pricing, financing, anything like that, you can fill out that form I just put on here. Look at our specials going on.
What the fuck is all the way from the left? I want to put it on the hip. Okay.
Awesome, Laura. We're in San Antonio also. We're in the Stone Oak area. Can you fill up hip dips?
Yeah, that's what we're doing right now.
That's probably why you asked, Lorena, because you can see him doing in that area. Yes.
Yeah.
See how the shape's changing?
200. We're at 400 total on the right side.
Oh, awesome. Very cool. I like that area over there. It's nice. Guys, just a reminder, we are showing this one on YouTube. So if you guys want to check out the full version of what's going on, he's taking the fat that he took from the lipo and putting it in the booty and hips area right now. If you guys want to look, check out the link in the bio. Go to YouTube, and we're showing the whole thing. Uncut, uncensored, the raw version.
1,001.
Oh, excuse me. You were asking what I was saying? Laura, is that what you're asking?
100.
He is doing a super mommy makeover. So it's going to be lipo 360, so lipo on the front, lipo on the back. He's doing a BBL, so start putting that fat into the butt. He's doing a breast augmentation. She's doing 450s on each side, and he's doing a tummy tuck.
Total 805.
She's getting the works. So Chester and Lorena, we have done some work with military and cancer survivors, things like that. So not totally out of the question to be something. Yeah, she's getting the works done, Laura, that's for sure.
The 18, we have 750 left. On the right side.
No, you don't. Good morning, Laura.
We have 100 left here.
A bit sore from the gym yesterday. Well, I'm glad you're going to the gym. That's awesome. Okay, Leslie. Laura, our morning's going good. We're having a good morning. How's your morning going? Leslie, good morning, Dr. Cornejo. I recently got surgery with you in February, a breast lift with implants. I had chose the teardrop implants, but I'm wanting a more round look now. What is the process for that, and how long do I have to wait to do it?
Maybe 6 months, but you come and see me when you're like 6 months, and then we can talk about it.
So Leslie, about 6 months, get a schedule a consult, and she said she got surgery with you in February. She did the teardrop implants. She's wanting more of a round look now, so she wants to change them.
We don't use teardrop implants.
Do what?
We do not use teardrop implants.
So maybe she just wants to change the look. I'm not sure.
We use round implants.
200 left back.
But
Yeah, Laura, we've been up for a little while now, but I wish I just got up. So Leslie, I would just schedule maybe a consultation and see.
yeah, like a follow-up. We can talk about any questions or any
A follow up and go through that and answer questions and see what your wants and needs are. Good morning, guys. Good morning, more TikTok people. TikTok, we are showing this one on YouTube as well.
200 to the hip.
We can live with it. Thank you.
Good morning, good morning. Thank you everyone for watching. We do appreciate it. Ask any questions you have, any concerns. We'll do the best we can to answer them. And if you have questions on pricing and financing and details like that, then you can fill out that form I just dropped in there or click the bottom left corner. We are doing a super mommy makeover today. So that's a lipo 360 with the BBL. She's getting breast augmentation and a tummy tuck.
300 is left. That's total 500.
morning, Maria. Good morning, guys. Good morning.
400, last order. Last 100. Whatever's in the tubing.
Thank you guys for joining us. Hope you're having a great Wednesday so far. We are here live with Dr. Cornejo doing a super mommy makeover in San Antonio, Texas.
You can go and delete button. America.
The girl the lady was asking about the teardrop. She said I'd asked for a more natural look. Maybe that's why I'm considering it teardrop. But yes, I have my follow-up in August. Okay, so she has her follow-up in August. Awesome. Yes, very cool. We're gonna flip.
Look at a marking thing. It's not your waist. It's not your waist.
Mm-hmm. Looks good.
Okay.
No,
Looks good. For lipo and BBL, I'm hoping I can do it under local. Is the wait time also 6 months for that?
Like
After her breast augmentation, does she have to wait 6 months for her BBL and lipo?
At least 3 months.
At least 3 months.
But this is on the local.
which one?
I don't know. Did you mean like local anesthetic? Like what were we saying about local? You're not gonna want to. Oh, excuse me. Sorry, Doc. I'm in everyone's way. Hold on, guys. Give me a second. Oh, she had her breast. Oh, can you have your breast and lipo done at the same time? Yeah,
Yeah.
sure.
Absolutely.
Sorry.
Absolutely.
I'm gonna do the bucket file.
Good morning, guys. He's gonna stitch and flip, right?
I'm sorry.
Stitcher and flipper.
Yes.
Okay, I'm gonna turn it off because I want to go with Dr. J next door. Okay, guys, thank you so much for joining us. If you have, I'm gonna pin this here on TikTok one more time to fill out this form. if you have any questions or concerns or anything you want to know about our services and pricing. And then feel free to shoot us a message on Instagram, anywhere you guys are interested in learning more, we can help. I'm going to let it go for about 13 more seconds. I'm sorry, I mean to say I had both done at the same time in February, but I'm wanting a second. Okay, so she had it both done at the same time in February, but she's wanting a second round of lipo with a fat transfer and hoping she can do it under local anesthesia.
Yeah, I don't think it's really painful to get that much life. No.
So it would be very painful, Leslie. So they're saying under a local anesthetic that it would be very painful to.
A little life on the local if it's just a minor area, but.
I think probably when you come for your follow-up, then you can ask all those questions and he can give you more details about that.